thank you for viewing my acne timeline. I wanted to chit chat with you guys and go more into detail about my personal experience with acne, along with sharing some tips and tricks that I learned along the way. And I also wanted to relay any information that my dermatologist recommended me. And please excuse my hair, I just caught myself in the viewfinder and I tried to make it nice, but it's coming out a little frizzy, but we'll go with it. Just so you guys know, I have combination skin. So I'm very oily in my T-zone area and then I'm dry in my cheek area. And as you could tell, I'm Asian and I'm a fair-skinned Asian, which makes my skin very tricky. I'm light skinned, but actually when I get a blemish, it's bright red and then I'll scar a dark purple and brown. So prior to 2019, I had never had to deal with acne. I had a couple of bumps here and there, but they were always under control and they would disappear in a week or two. So last summer, the summer of 2019, right around the same time that I got a promotion at work is when my skin exploded. So it started off with 4 or 5 bumps, and that's still more than I would normally get, but I didn't realize how bad it was going to turn out. I was averaging about 3 deep, painful cystic bumps a day. And at its worst, I had about 50 on each side of my neck, starting from the bottom of my ear to the front of my chin. I had about 20 on my right chin and lip area, and I had another 20 on my cheek area. So please know that the photos in my acne slideshow isn't a true representation of how bad my acne was. Sorry, I have to move my hair, it's getting in my way. So my acne was very deep and they never came to a surface, and so it was really hard to photograph that. But just know that I had it pretty bad and most of them were underneath the skin. Like I could literally grab my skin and feel like a nodule underneath my skin and it would be filled with liquid and they would never surface. I also wanted to mention that the slideshow were photos of my face, but I did have cystic acne down my chest. I also had about 50 painful bumps on my shoulders and back. And I'm letting you guys know how much I had just because I'm the kind of person that would wake up and literally count any new and existing bumps. So I would be there like 1, 2, 3. Every morning I would count how many bumps I had. So not only is acne extremely painful, it's also extremely itchy. And that was something that caught me off guard. I never knew that acne was itchy, and that was something that was new to me as well. I had never had to deal with extreme persistent itch, and let me tell you, it's very annoying and frustrating. I was so frustrated at how itchy it was that I was almost becoming angry. It was very, very uncomfortable. So if you've ever had to deal with persistent itch, you'll know that it makes you very irritable. It's not something that you could ignore. It's something that's very, like, it's on the top of your mind. That's all you could think about is how itchy you really are and how you want to scratch but cannot scratch. And I was itchy for weeks before I found a remedy for it. And what I found that really works is ice. So ice really calms the inflammation and itch. So every time I had a free moment, I would ice my face. So literally when I came home from work, I would wash my makeup off and then I would ice my face. I would ice it on the weekends, and I would also sleep with ice packs all over my face. At first, I didn't know if it was my acne that was itching or something that I was using as an acne treatment that was itching, but it was indeed the actual acne itself. And even when I went to the dermatologist, the first thing she said when she observed my acne, she asked me, "Are you itching?" And I was like, yes, like, how do you know? Like, yes. I was just like, oh my gosh, like, she knows, like, somebody knows. And that leads me to my next topic, which is when I decided to visit the dermatologist. Before seeing a dermatologist, I had tried everything. I was spending most of my time at Ulta buying anything that was recommended for acne treatment. And I was also seeing 2 estheticians at that time for facials, and my skin was only getting worse. And it was my cousin who suggested that I see a dermatologist, but I didn't listen to him right away. I usually don't listen until I hear the same thing twice by a different source. And so by the time my friend had suggested it, that's when I had decided to make an appointment. At this point, my acne had gotten so bad that there was no excusing it away. It wasn't like, oh, it'll get better, or it's not that bad. People were more concerned. So I was getting suggestions like, hey, Amy, like, maybe it's time for you to see a medical professional, or Amy, have you considered seeing a dermatologist? And so that's exactly what I did. So I really loved the bedside manner of my dermatologist. I remember the first time she walked into the room, she just was glowing. She had perfect skin. And there's nothing worse when you're dealing with a whole face and body of acne and you see someone that was just completely flawless. But in any case, she was a gem to work with. She was always very patient with me. And I can't explain it, but I felt like I was in really good hands at this point. Before I went to the dermatologist, I was kind of a lost puppy. I was pulling at whatever I could to help my acne, and I didn't know what I was doing. I had no sense of direction. I was trying a lot of different things without truly knowing if they would work and if I would see results. But when I went to a dermatologist, I just felt like I was safe and protected. I felt like I was in good hands. I really felt like I should have gone in a little bit earlier than I did. And I just felt like things were going to get better. With all the money that I spent buying all these drugstore products and seeing facial ladies, I could have just went to the dermatologist and been on the correct path to fixing and healing my skin. So right away, when my dermatologist saw me, she pointed out that where I was breaking out was on the lower portion of my face. So most of my breakouts were where a man would usually grow a beard, and that's a sign of hormonal acne. The placement of where my acne was and how deep they were is a sign of higher male hormones. And so she gave me Epiduo as a topical to put on, and she also gave me the choice to choose between 2 oral medications. She gave me the choice between an antibiotic and spironolactone, and I chose to go with spironolactone, which is a high blood pressure medicine that is used off-label to treat acne in women. Since spironolactone lowers male hormones, it isn't clinically used to treat male acne at this time. So when I was under the care of my dermatologist, I was literally only using a handful of products. So I was using CeraVe Gentle Face Wash, which she gave me a sample. And then I was using Epiduo and Vaseline in the crevices of my face. And then I was taking spironolactone. So what I've learned with seeing a medical professional is that less is more. When I had told my dermatologist the things that I was using because I had Googled it, she looked at me like I had 2 heads, like she was not impressed. So here's my bottle of Epiduo. Epiduo is a combination of benzoyl peroxide and adapalene. So benzoyl peroxide kills the bacteria that causes deep, painful cystic acne, and adapalene increases cell turnover. So when I first started using this product, I thought it was weak. I was like, man, this stuff sucks. And I kept using it for 2 days. I apply it at night, and by the 4th day, I was experiencing burning. I was like, wow, this stuff is way too strong. I was literally peeling. Like, my face was peeling, and I did go through a purging phase. So this stuff will make your face purge. And what I mean by that is that any acne that you have beneath the surface will come to surface all at once. So it actually looks like your acne is getting worse than it is getting better. And that's something that I mentioned to my dermatologist on my follow-up visit. And she confided that it's normal, that's what's supposed to happen. So instead of having like your acne is at different stages underneath your skin. So you might have a breakout here, and this one is just bubbling under the surface to come out next week. So this product will make everything come out at once, and so it's worse at one period and then it's all gone at once. So I have to say it's very irritating. I underestimated how strong this was when I started it, and it is very strong. So you want to just use a pea-sized amount, and you just want to apply it to where you have the severe acne. But it would burn. Like, I would apply it on my cheek and it would burn this inner corner of my eye. And I was like, I didn't apply it anywhere near my eyes. I avoided this whole area, but it would still burn. Like, I would put it down here some days and it would burn my nose. And I was like, my nose is like, it's chafed. So to combat that, I applied Vaseline. So you want to apply Vaseline to the crevices of your face, which are the most sensitive. So I put Vaseline all around my eyes. I put it on the edges of my nose and down here. And then I also put it on the edges of my mouth. And that really protects the epidural from burning the sensitive areas of your face, because it does travel. And that's something that I learned, because I was really confused at first. I was like, if I'm putting it on my chin, why is it burning my nose? And I'm like, if I'm putting it on my cheek, why is it burning my eyes? So that's something to combat that. So Epidual is prescription only. You can only get it if you visit your dermatologist. But a drugstore dupe that you could do is just go get benzoyl peroxide and adapalene. Those are both over-the-counter products. So a good benzoyl peroxide product is Zapzyt, and I actually have a tube right here. So you could use Zapzyt as your benzoyl peroxide, and I don't have a tube on me right now, but you could get Differin. Differin is adapalene, and so if you use those two, it's the same ingredients that are in Epidual. So again, benzoyl peroxide, you could use a Zapzyt, and then for adapalene you could get Differin, and then use the two in combination, and then you'll have yourself a little Epidual. So I wanted to quickly touch base on another popular acne treatment ingredient, which is salicylic acid. It's a very popular acne treatment that's available over the counter. Now I want to mention that I did not use this to treat my deep, painful acne, but I wanted to mention that salicylic acid cannot be combined with adapalene. So those two ingredients cancel each other out. So it's important that if you're using Epidual or adapalene or Differin, to not use any salicylic acid products, no face washes, none of that. So I want very quickly, I wanted to tell you the difference between salicylic acid and benzoyl peroxide. So benzoyl peroxide kills acne bacteria. So not everybody has acne. Just because you have a breakout doesn't mean that you necessarily have acne. So acne is when the bumps are clustered together and you have a lot of deep, painful nodules. and that's what you would use a benzoyl peroxide for. Salicylic acid more so removes the top layer of your skin, so it helps exfoliate, and this is recommended for bumps that are on the surface of your skin. So if you have whiteheads or blackheads, you would use salicylic acid for it. So spironolactone is a high blood pressure medicine that is used off-label to treat hormonal acne in women. It reduces the male hormones that cause acne in women. It's also known as a water pill, so it makes you urinate quite frequently. I was a little bit concerned because I tend to have low blood pressure and it's a high blood pressure medicine. So I brought that up to my doctor, and she said that it should be fine, but they would start me off at a very low dose to see how I felt. So they started me off at 50 milligrams, and it was fine. I didn't have any side effects. I didn't even notice increased urination. So by my first follow-up, they had increased me to 100 milligrams, which I took for the rest of my acne treatment. So you could take spironolactone any time of the day, and you take it once a day. So I usually took it in the morning. I did that so I didn't have to wake up and urinate if I needed to. So I took it in the morning, and I drink a lot of water as it is, so I didn't notice any abnormal side effects. So one last tip that I want to leave you guys with is that if you absolutely have to pop a pimple, because I would tell my dermatologist, like, hey, if I see a little bit of pus and one of them is ready, like, I can't stop staring at it. And she was like, okay, it is okay to pop if you do it correctly. So what she recommended was that I wrap my fingertips with toilet paper. Oh, toilet paper is a scarcity right now. So if you don't have toilet paper, you could also use a cotton round. You could use gauze, a paper towel, or even a clean napkin, and just wrap them around your fingertips, and so that your direct nails isn't touching your skin. So once you have it wrapped, you could go in there and put pressure. If it's ready, it should come out in the first 10 seconds of you applying pressure. And if it's not ready, then you're only digging it deeper, so just leave it alone. So that was it, guys. The combination of spironolactone and Epiduo helped clear up my skin. I was under the care of a physician for about 5 months. And yeah, I felt my skin had cleared up to the point where I no longer have to return for follow-ups. So currently, as it stands today, I'm very happy with the condition of my skin. I'm still dealing with dark marks, but it's nothing that I'm self-conscious about. I'm okay with that level of imperfection on my face. It's okay. It's been a good year. So my acne journey started last summer around this time, May of 2019, and it is now May 2020. Happy quarantine. But I'm currently now off of Epiduo and Spironolactone. I just took my last pill last night, and I don't plan on renewing my prescription. And so I'm very happy with my results, and thank you for following me on my acne journey.